We'll call this meeting to order. We'll call this meeting to order. This is the Business and Support Services Committee meeting, Monday, February the 8th, 5:30 p.m. We're in the Amber Yuri Boardroom, 1620 Houston, and we will now have roll call.
Dr. Celia Moreno,
Present.
Mr. Hector Noyola is here.
He's here.
Mr. Jesus Martinez here. Mr. Jose Valdez.
Absent.
Mr. Ricardo Garza.
He's present. Okay.
He's coming in, he's in the back,
Okay.
okay. Mr. Hector Garcia.
Present.
And Mr. Jose R. Perez.
Present.
Thank you. We do have 5 members present.
Pledge of Allegiance, Mr. Garcia.
Pledge
Allegiance to the flag
of
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dr. Nelson, first item.
Thank you, Dr. Moreno. Good evening. We request permission respectfully to move up items number 9 and 10.
So
May I have
moved.
permission?
We have a motion and a second to move up items 9 and 10. All those in favor?
Aye.
Opposed? Motion passes.
Thank you. Item number 9, if I may do item number 10 just briefly. We wanted to have this conversation today as our budget update for the month. And really what we need is between now and the budget workshop in March, we think we'll be able to move a lot further down the road in bringing actual numbers that forecast 16 and 17. So that's the update. We will not have a budget workshop at the end of February. We will continue our March scheduled meeting. And what we're trying to do is work with human resources to review our staffing at every level, both paraprofessionals and professionals and every campus. And you'll see our health insurance update, which we want to absorb. It's good news, we think. And then start to prepare for some salary discussions that we think the board would want to have. Before we introduce our special guest, would you like to acknowledge the trustees that have joined us?
Yes, Mr. Noyola and Mr. Garza are both here.
Okay.
You marked them present already?
Yes, ma'am.
They were marked present.
Okay,
Thank
I'm
you.
sorry. So then that's really, that takes care of item number 10. For the record, the public, we want them to know that we met in January and went over our calendar. And so everything is going according to plan. We're in the second year of our biennium, so we don't expect any huge changes in what we've been discussing thus far. Any comments or questions?
We are
regarding-
going to talk about it, because there were some things that we wanted to make sure that you all are, it's in the scope of what you're looking at for the budget of 2016-17.
Well, absolutely. To answer your question, we're going to talk about it. Most of what you and I spoke about, things like UIL, fine arts, all of that is in the
being
presentation
addressed.
that's coming as March. We don't think it's exhaustive, but we want to show you what we have so far in terms of next year, and then allow the board to make changes or suggestions.
Is someone looking at the issue of the secondary schools and the intervention classes that they need for the students who have failed? And the fact that it could be that they have other teachers that that there's not a demand for their subject area.
Yes.
That there may be excess, so that it's not more numbers, but configured differently than what we currently have.
Instead of filling another health teacher, we might convert that to a math intervention teacher.
Yes.
Absolutely. That's part of our staffing.
In Moreno.
Yes, Mr. Perez?
Yeah, I want to make a comment that we are going to be looking at personnel, right?
Yes, sir.
And to see what the needs are.
Yes, sir.
And also, I'm just introducing the idea of the incentive. Remember we had about 5 years ago for the ones that are going to retire. I don't know if it's time to look at it, or at least, have an idea of if it's time to do that or not.
Yes, sir. We have an agenda item on that tonight.
Okay.
And the possibility, I know that it's not going to be popular with the rest of the board, but the possibility of bringing our discretionary down. I think that we're spending that $75,000, bring it down maybe to $50,000, so we can save on that and use that more into in our numbers with our school, and to make sure that we have enough to go around.
Yes, sir. Any other comments or questions regarding our budget? If not, may we have permission to go to number 9?
Yes.
Item number 9 is discussion and presentation on the LISD Health Benefit Plan. Dr. Moreno, members of the board, we have a special presenter. We appreciate you allowing us to move her up in the agenda so that she can make plans to return to El Paso this evening. We have Miss Elisa Olguin from Hub International, and she has a presentation. Ms. Ayala, does the board have a paper copy, or is it just electronic? So it's on your laptop, and she'll be doing the slides on your laptop as you go. So with that, allow me to welcome Ms. Olguin.
Thank you, Dr. Nelson. Good evening, board members, members of the audience. My name is Elisa Olguin. I'm Senior Benefits Consultant with Hub International. The intent of the presentation this evening is to provide you with the status of your health fund and your health plan to let you know how things are going. I hope and I think you'll be pleased with the information we have to provide you this evening. So,
Can you get a little closer, because I can barely hear you?
Yeah, just pull it.
I'm a mom, I can get really loud.
There you go.
Okay.
I'm old and I'm deaf.
So just for reintroduce everyone, or for those of you that are not familiar with our team, Randy McGraw, who you may have seen before present to you all. He is my partner, and Elisa Olguin, obviously, and Debbie Lopez is the Director of Data Analytics. So it's just a reintroduction to our team on this particular slide. This just goes over what we're going to talk about this evening. I'll try not to make it too painful. Just to refresher on how your health plan works, just to remind you all that you are self-funded, where you were previously fully insured. That is where an insurance assumes all of the risk in exchange for a premium from the school district. A few years ago, you made the decision to go self-funded, and you'll see the fruits of your labor a little further on. So the data that we're looking at tonight or this evening does look at September 2015 to December of 2015. Captures the first quarter of your most recent fiscal or benefit plan year, and one extra additional month in that. So the screen that's currently on, conscientious about this. So the screen that's currently on, or the slide that's currently on the screen, does talk about your first quarter, second quarter. That's how those are broken up. You will see that the first quarter, which is from September to November, we do have a total of $4,250,875 that were incurred. Second quarter, of course, we're not complete with the quarter. We're 1 month in as far as the data is concerned. It's too soon to obtain January's complete data at this point. But it does break it out, and if you go a little further down, it breaks it out as far as which category is incurring those claims. If you recall, you do have 4 different benefit plans, 4 different health plans that you allow your employees to choose from. The low plan, which is the one that has the most enrollees, which is, if you go over to the right-hand side, it's this employee average census. You will see that the low plan is capturing 2,137 employees. So, of course, that is carrying the most employees. It is going to cost the most. What I want to really focus your attention on this slide is the second to the last column, which says PEPM. That stands for per employee per month. So for every full-time employee, this is what they're costing you on average per month. Total of $488. When we look at per member per month, that includes employees and covered dependents. So that's, a lot of people refer to as belly buttons on your plan. So that includes spouses and or children that are covered on the plan. So we're at $359 per month. The graphs on the bottom just illustrate the same information that is identified above in a more illustrative manner. The next slide does give us, again, the breakout of the enrollment. So the number of employees, again, the low plan is carrying the most of them. We do have several dependents that are covered under that plan as well, because it is obviously the most affordable plan, very rich plan. And we have 2,894 total member lives on that plan. As you go onto the high plan, $875, the state plan, which is the richest plan that you offer, you have 3 employees or 3 lives, and then the consumer-driven plan, which is that high deductible health plan, 202 enrollees total. The total paid by health plan, which is what we want to look at again, it's a reiteration of what we looked at on the previous slide. Your low plan is incurring the most cost simply because you do have the most participation on that. And it's balanced out with the contributions that are being made to it. So when we look at the per employee per month, again, I won't read that to you, but it does, you will see that the consumer-driven health plan is the least expensive for the district as far as claims are concerned, and the per member per month is also extremely low on that particular plan. And that in part is due to the deductible having to be met before some of the benefits do begin. So that could be one of the reasons for that. In our analysis, we do look at your catastrophic claims. We want to benchmark those to find out how they're going with the diagnosis, the prognosis looks like. Right now, we have 8 catastrophic claims at the benchmark of $50,000. Now, your stop loss deductible is $200,000. So anything that's exceeded the $50,000 up to the $200,000 will not be illustrated, obviously, in your stop loss report. Of course, stop loss, just to remind everyone, is the insurance that helps back up the health plan should any large claimants above $200,000 occur. We have had 2 such claimants, and you'll see that illustrated in the red rows below. Number exceeded ISL 200. ISL stands for individual stop loss. So we've had 2 so far. Of those, we had 602 602,000 come from the health plan. So we also break it down as far as where are the dollars being spent? What categories are we looking at? Inpatient facility is obviously, as we look at different trend or different factors, that is one of your highest expenses. Outpatient facility, which would be x-rays, which would be outpatient surgery, that falls into that category. Professional office visits, just professional type services. Pharmacy. I would like to point this out to you because your pharmacy is second as far as the cost drivers, or actually it's first if you look at the far right-hand side. And your pharmacy is trending a little high, but I do understand we have a meeting scheduled later this month to discuss that with Prime Therapeutics as far as some cost containment measures.
Quick question, wouldn't you consider if it's a little high, it might not be a bad thing that they're taking precautions that it doesn't get into high blood pressure medicine, diabetes medicine and all this, so it doesn't affect the other numbers? I would imagine it would be high just for maintenance.
That's a very good point, Mr. Garcia, because that is actually something that we look at. We'll see in a couple slides where we break down the therapeutic classes so you can see exactly what types of diseases are driving those costs. But you're right. We do want folks taking their medication for diabetes. We want them taking that high blood pressure medication. Unfortunately, the pharmaceutical industry as a whole has been trending upward. And it's a little higher for your group, but again, it could be attributable to some of those higher cost ailments that folks are seeking treatment for. So we want them to do that. That's where we're going to slice and dice the information when Blue Cross Blue Shield does come out here.
Do we pitch the idea of getting medication through the mail on a 5-month or 6 months, where it brings down the cost of medication, so it's not a monthly thing, but every 6 months, it brings down the cost do we promote that?
You do currently have a mail order program in place. It's not mandatory, so a lot of employees find it a hassle, for lack of a better word, to go to their provider, because at that point they have to get a couple of prescriptions, one for retail to get it immediately, the other one for mail order. So some folks may start and then they stop doing it, but that is one of the cost containment measures. We have had some clients that make it mandatory for anything that they're taking on a daily basis, on a regular basis, for something like a high blood pressure, high cholesterol, a diabetes, where it does get mailed to them. So that is definitely one of the cost containment measures. There are several, to include step therapy, where you have to try the less expensive medications before you go up to the $1,000 a month medications. These are all different ideas that are discussed in the pharmaceutical benefit management world. So yes, sir.
Okay,
Do we have an opportunity to get the 3-month supply locally, or does it always have to be mail order?
It would be mail order at this point.
Because you know that there's other companies that allow you to get the 90-day locally.
Yes.
TRS does. That's
TRS
part of-
does?
Oh, yes.
So that's something that we can discuss with Blue Cross Blue Shield. Typically what happens, and I'll explain how they come out, is they'll run illustrations based on your utilization and say, if you had had this program, this is the potential savings. If you'd had this program, this is the potential savings. So based upon their presentation, we can go forward to the Benefits Committee and explain what the options are that are available.
But if we have incentives for them to move over to this, it might at the long run help us, because it's going to bring our prices down with any little incentive that we can, as a district, to promote and try to get people to do a 6-month thing and help them register for it, and make sure that the incentive's good enough that they want to stay on it, and we might see a savings.
Right, I agree with you. Typically, they do 3 months at a time. One of the drawbacks of doing that, just for someone that hasn't taken a medication, you'll see some drugs later in the presentation that are maybe $5,000 a month, $6,000 a month, so we definitely don't want to send out $21,000 of drugs to someone. We want to have them try it and see if it works, and then possibly do something like that. So there are pros and cons to either approach, but definitely.
Well, they're probably are identified as these qualify and these others don't.
Right. And what you're saving on when you do something like that, obviously, is the administration fee for every prescription dispensed. You'll save a month of that.
Right.
Okay, did I answer your questions? Thank you. So this talks about, again, this particular slide. You'll see September 2013 looks very low. That's not a typo, because I also looked at it, and it's when you made the transition from fully insured to self-funded. So of course, the pipeline was not completely full, so you did see that go up. This does break your expense down by pharmacy and medical, pharmacy being represented by the green line, medical by the blue or bar chart. You'll see that, November, we're starting to see that gap, or the pharmaceutical again increase. So this is the 12-month moving average, and this is per employee and member. We break it out in blue and green again. Blue is per employee per month. Again, this is per insured, per employee. And then the green bar chart is your per member per month. So again, it just illustrates the cost average per month that we've previously discussed. We put it in different formats. This is your historical employee enrollment by plan. Again, it goes back to September 2013. You will see a shift from the high plan. You have a lot more folks joining the consumer-driven health plan, and then the low plan, which of course is representative of the numbers that we saw in the previous slides. This, moving average chart, the top green line is the state plan. It's a lot smaller population, so you will see that it's pretty jagged. It's not as consistent as the high plan, which is the red squared line, or the diamond blue line, which is the low plan, or the CDHP plan. This is just, again, the average cost per member per month. So this one breaks it out, this particular chart breaks out your expenses by relationship. We do know the top line is your spouse, your insured spouses or your covered spouses. Typically that does tend to run high. Historically, spouses are your most expensive risk because they're not actively at work for you, so you don't know if there's anything potentially going on in their household or any ailments. It's a smaller population, so it is a lot more jagged. You'll see it go up and down in a jagged manner. And it is running a lot higher than your employees. Your employees, blue line right underneath that. And then your children are the green line. Children are always your best risk, so we see that way at the bottom.
Real quick, one thing I've seen that we offer within the school to our employees, different programs for exercise and all this, but we don't offer their spouses anything, and this is, you know what, the spouses are the ones that are way up there. Have we ever considered the looking to bring their spouses in, or setting up programs for their spouses where we can't monitor them, but we can offer, like we do at the swimming pool, and
Wellness
different
program.
things, yeah, a wellness program for spouses, because every time you hear and I read, it's always just employees and administration, all this, but the spouses that we're covering, there's nothing for them. So I could imagine they would always be hired because they're at home or whatever the situation is.
Right.
But we're not catering to that, but we're paying for it, or they're paying for it, but still, it affects our numbers.
Absolutely. I can't speak to the programs and having them
Don't have
extended. You don't have them, but
No.
that can be looked into as far as
Do we have
including them.
No, we don't. Not for
Not for
spouses.
spouses.
We might want to look into that, just as a,
Maybe-
Yes, Mr. Pettis?
Yes, I think it would be a good idea, like Mr. Garcia says, that maybe we can talk to the city. I think the health department is having exercise classes, so maybe we can have what do you call it, when you work with them, and provide those classes for everybody. And then maybe that we can work something out in that area.
Well, once we get together with, and God willing, when we get the finance committee together again, and we start talking about this, we can get, as we did at the beginning, get TSTA involved in this, and they can pass the word on to their memberships as to these driving forces that are here. We talked to them when we got the insurance going about what it means to the employees themselves, but now they get to see how it drives it, what the drivers are, and how we can get affected by this. But there's no better way, in my mind, to get it over to the home place than with the teachers themselves or the employees themselves when they're here on the table. So it might be a good, either way, the city or anything we can do to pass on that word, I'm all for it.
Absolutely. There are different approaches to wellness. And for those that are in the early stages of an illness, perhaps we can help mitigate some of that expense as it progresses. Unfortunately, we will have a pool of employees, or spouses rather, that the prevention is just, it's not there, or we can't prevent certain things like muscular sclerosis. That's a big one. Rheumatoid arthritis. There are some things that are just congenital, or there's no going back, I guess, for lack of a better word, but for those that it is provided for, absolutely. Exercise, as far as diet information, that's all great information to disseminate to the home place.
because in the chart, what we have control of is our employees to a point, and our children, because it's schools. And you see that they're within the range. But what we don't have control is the spouses, and it's way out there.
It is, and it also, you have a smaller pool, so that's why it looks so jagged
that's
as
true.
well. So we just want to be mindful of that too.
Okay.
And maybe we can also get our local coaches when they're not coaching their sport during the school year, maybe they can teach some classes.
Aerobics.
Yeah.
Thank you.
Thank you.
But you'll break it down, once you get the information on the pharmaceuticals of what, like you just said right now, with arthritis, some of them have to do, it's genetically there. We're not going to be able to do too much about those, but there's some that are going to be directly tied into their living conditions, their health condition, and their activity condition throughout the year.
Right. And I jumped ahead really quick so I could give you an idea.
The majority be having children, childbirth?
Childbirth is not so expensive unless you have preemie babies.
Okay.
That's really where it hurts financially to the health plan. But typically, a regular childbirth is not
expensive.
not bad. But to your point, I brought up slide 15. I jumped ahead a little bit, so I didn't go in order. But we did run a report of the, excuse me, the most expensive prescription drugs being distributed. And if you look at the first one, Humira is for rheumatoid arthritis, Crestor is high cholesterol. What I found interesting is you have several diabetic drugs in this category. So just looking at it, there's some that are insulin type drugs, but they are not labeled as insulin. For example, Victoza, that's a diabetic drug. You have a high prevalence of diabetes, so maybe some education surrounding diet in conjunction with the exercise would help to offset some of these expenses in the future. But these are the most expensive drugs, and actually this is not, there are more expensive medications that are fortunately not hitting your health plan. I don't know if you've seen the commercials for the hepatitis C drugs, the Sovaldi. There are some very expensive medications. Fortunately, those have not hit your health plan. You don't have those in the population. But we do look at your medications as far as what is being dispensed, how often, how many employees. So for example, the Humira, you'll see that you have 6 claimants, a total of 24 prescriptions, and that's affecting the plan by $69,000. So per prescription, it's $2,889. It breaks it down to that level. Now, there are, of course, several other medications that are being taken, but we did just benchmark the highest cost. Now, all of these are not specialty because we hear a lot about specialty medications. Those are typically your injectable type medications, non-insulin. You'll see the indicator in the middle. It's a special indicator, yes or no, or Y or N. Those, you only have 3 that are considered specialty. So again, this will be the focus point of the conversation that will be had with Blue Cross Blue Shield Prime.
Yes, Mr. Perez?
When you consider the medications and their brand names, they're usually higher than generic, right?
Correct.
When you go into like Humira and everything, for their brand name, so it's going to be higher.
Correct.
Can we recommend in Moreno to use the generic, or we cannot?
Well, that's part of the plan that they're going to bring forward. Is there a way to introduce the idea of that you
Generic.
try the generic first, and if it
Right.
doesn't work for you, then you go to the more
Right.
brand name.
Exactly. It's step therapy, where you start with the least expensive, least invasive medication, and then you work your way up if that's not effective. So, and a lot of these, unfortunately, do not have generics available yet. They're still under patent, and they're going to be under patent for a while. The one that I believe is coming off is Crestor, but that's only second. Any questions on this slide? Oh, my God.
That would be the one.
So the pharmacy, again, the per employee per month, you're running right now at about $128 per employee per month. Per member per month, it's at about $95. So again, it's running a little high. Nothing, we're not concerned as far as when we looked at the data that it's it's headed off a cliff. We do need to look at it, obviously, to rein those costs in, but it's not devastating at this point. So just to let everybody know that. We also look at the top providers that are being paid out by our plan. Laredo, Texas, or Laredo Hospital is the highest on the list, and they had 39 claimants, 191 days of hospitalization. So of those 39 claimants, it was a total of 191 days that they were in the hospital. And that, of course, was your most expensive. It goes all the way down. And of course, Christus, Santa Rosa, you have a lot of providers, it seems, in San Antonio where your members are going to. So, outpatient facilities, these would be outpatient surgical type settings or dialysis. And this kind of, again, looks at your, when I was reviewing this, I looked at your medications and then I looked at this particular list, and you have a lot of dialysis centers on here. So again, that says to me there's opportunity for diabetic education and prevention, because you do have several on the list. The professional providers, again, another list to let you know who is receiving on a professional provider basis. Catapult Health, I just wanted to point that out. They're the ones that are doing your wellness, and that one is in the middle. It's 1, 2, 3, fourth down. That is actually your wellness, your worksite wellness provider. But these are the providers in the area that your members are seeing. And again, just going back to the drugs at the bottom. So this is the financial page, the page that everybody asks, especially as you're going into budget season. Wanted to, again, just re-emphasize or re-explain how this is generated. If you look at the first column, obviously those are descriptors of the data that's in the second column. The second column, the data that we're looking at is January 2015 through December 31st, 2015. That's what we're basing these projections on. Please keep in mind that these are projections based on what has currently occurred, and then it's annualized out, so that way you have a good idea of how your plan is running. So it says calendar year 2016, so we're making a projection into the future, and based on that, we anticipate your total medical claims to be at 11 million, a little over 11 million. Prescription at 4 million, a little over 4 million, and your total claims at 15,533 and 670 and 32 cents. So those are actually annualized based on the claim data that we have. The per member per month cost through 24/18. The annualized contributions, that is what your employees are paying as well as what the school district is providing on their behalf. That's where that number comes from, the 18,994,447. The weighted annualized claims, again, that's what we're anticipating as far as claims are concerned. Stop loss recoveries, this is what we've already known, this is what we've received. So anything else, of course, would be going to the plan to reimburse whatever's been spent. The trend factor, currently we're looking at about 8% medical trend. Pharmacy's a little bit higher, just 0.1% or so. Excuse me. And right now, currently, I'm going to jump to the bottom. The total projected plan costs without the reserve, 19,423,794,000, or 423,000, and that is what we're expecting for the current, or for 2016. The starting reserve is actually what you had in the bank when this was done, or what we're projecting. The ending estimated reserve, again, estimated, would be at 5 million. So you'd have a surplus, for all things consistent, of 1,016,000. So that's, again, good. What I really want to call your attention to is the green and yellow boxes on the right-hand side. This is as you're planning for next year. I know you have a lot of decisions to make as you're talking about the different campuses and positions. We take that data, annualize it again, and based on that, in order to reach your target, and the target is listed above, of 4,306,299, it calls for a 3.52% increase. Now, that would be 3.52% from the district and from the employees. That can be offset, and I want to make this real clear because I know you were talking about the benefits, that this can also be offset by some plan changes. So it doesn't affect everybody's payroll deduction, but only those that are using the plan. We could help mitigate, again, that increase. If you wanted to hold a reserve to constant, it would be double that amount. Not really recommended. Want to look at that green box at the 3.52% increase. Any questions on that? I kind of ran through that. Yes.
So in actuality, the employees are going to be raised the fee how much from yesterday? Or from last year?
We want to go zero.
Oh, okay.
I have a question. Do you all think if we have, I know Mr. Perez said, mentioned it a while ago, and I would support that, the early retirement, do you all take all that into consideration, the people that are retiring earlier, if we have a retirement on that, because they're older, they could be part of the numbers here. Is that taken into consideration when y'all are going to determine our pricing for next year, or is it not? This is based on based on what we have right now, But is it
Correct.
going to be based on, if I have a retirement of 30 teachers and 26 of those teachers are high maintenance, or for whatever the reason, is that considered into our numbers?
Yes and no, because historically, folks retire every year. So when we look at the rolling 12 months, we've had retirees fall off
Right.
at that point in time. So moving forward, it factors into the numbers, but having made a conscious decision to say we know that 40 people are going to retire, no, we look at the hard
Well,
numbers.
but you're considering, you're considering apples and oranges. You're considering a formula that you have on a regular retirement compared to an opportunity that we give our employees to retire. We put an incentive for them to retire. So you get, instead of 5 or 6 people or whatever the situation, you probably get double, sometimes you get triple. I know when we did it the first time, we had a big group of retirees. So it's really not on an average, because this is not an average year, but if we do something like that, there's more to take that advantage or take that little extra money that we're putting in there so they can retire and a younger generation comes in, so that our numbers change.
To answer your question, no. We don't know what incentives you're putting in place for them to retire, so we can't factor that in. In addition, we
But would it be
don't,
considered to be factored in? That's my question.
because of HIPAA, we can't determine or pull those claims out, because then we'd have to look or bring that information forward. So you could tell me, like, John Doe is retiring, and we would, to look at his data, we don't break it down to that person. It's on the aggregate level.
Mr. Loyola?
Do you have an average age of employees for LISD?
Yes, we do. It's not in this presentation, though we can get that for you.
Is that a factor in determining the fee for the overall expense?
It's in your weights as far as the trend assumptions. It's factored into that. But as far as us putting that in or making a significant increase, because it could be, as we mentioned before, a preemie baby that totally or completely increases your costs. So it's not to that level of detail. It can be, but it's not to that level of detail in this presentation.
Let me ask you, Ms. Pro, do you think it would make a difference? Do you think it would make a difference if we had those numbers, or, I mean, if we had the kind of retirement that we had when we did it the last time?
It depends on the high number.
In the high number, right?
I would need to look at that. And I would kind of have to see their utilization to tell you whether.
No, I understand that, but the way I'm just seeing it in my mind is we're getting a cost, and a cost is given on an average of what we have. But if we actually do an incentive that is more than your regular average,
All of them are healthy and they're going out.
well, that's what we don't, that's the
We don't know.
question.
Well-
If they say they're not healthy, that's why they're gonna get another retirement, or whatever the situation is.
And only when they're not healthy, they don't.
Okay,
In other words, they are high risk, right?
Right.
That's what you're saying.
okay, thank you.
Okay.
You're welcome. So again, these are the comments that we're bringing forth. The historical claims data used for the 2017 projections was based on 2015 claims data at this time. We are looking into the future, or attempting to look into the future, to see what the cost will be a year from now, because all things may change, but all things being equal, the numbers should hold the way they are. Since the engagement with HUB, LISD, you've had the same contributions to the employees, so that hasn't changed. We did have to address the deductible on the HSA plan, the consumer-driven health plan, to be compliant with IRS regulations, so that was the only change that we've made in benefits. So that is definitely an area of opportunity to help absorb some of that expense. So since the transition to the self-funded approach to funding the medical plan, your contribution hasn't increased since December 1st of 2013, so that's good news, because if you were still fully insured, you would have received a few increases over the years. So the employee deductions did increase one time. In 2014, they went up approximately 9.25%, and will continue to remain until the end of this year, and from what I understand, into next year, which is very, very good. And at this time, we're recommending, as I mentioned, and it's 3.52, those numbers are transposed, 3.52% increase over current for an average of and the district's portion of $384,000 annually, but I understand you're talking about absorbing that. So I've discussed the last point that where we may want to discuss plan changes to help offset some of that expense that the district, so you won't affect or feels as affected. So that is all I have. Do you have any questions additional?
When are you coming back with another report?
We can come back, well, when you start your budget, we can go ahead and look at that, but whenever Ms. Ayala tells us you would like another report, we'd be happy to come and give you another report.
Could we get that report before we meet?
What is it that you want to?
We have,
Yeah,
This same information.
So we could have read it beforehand.
We did.
Madam President.
We provided you with a board update with presentation now.
That
The-
presentation was on
With
the
this-
board update?
Today's presentation, yes, ma'am.
Ms. Moreno.
But we can provide it to you again, no problem. The consulting services are up for bid. We do have a recommendation. We do have the vendors that responded to the bid. Their Hub International's contract expires at the end of March. But we already went out for bids. We have a recommendation, but there's a committee that's going to be involved in making that selection again.
No, we do have a committee, right? You appointed the committee?
It will, today we'll
Okay,
mention that, and it'll
Okay.
happen on Thursday.
okay.
So the main thing that we, Dr. Moreno, members of the board, and I think this is important to note, first of all, I want to thank Ms. Olguin and Hub International for your thorough presentation and your time and effort to our organization. Having said that, for me, respectfully, the bottom line is an approximate 3.5% increase at an approximate cost of $384,000 annually. At this point, the Chief Financial Officer and myself are recommending that the employer, the district, absorb that $384,000 annually as part of our budget development process and bring a balanced budget with that absorbed.
So we don't have to put the committee together, and that'd be the recommendation?
The committee is for another purpose.
Huh?
The committee is for another purpose.
Oh, okay.
It's for the purpose of that new contract.
Okay.
For the purpose of the insurance consultant contract.
Right.
So that committee would basically meet one time to review everyone that responded to the health insurance consultant contract. So that's where we're at, and we think that's good news, considering the complexities of the Affordable Health Care Act and the rising cost of insurance across any organization with 50 employees or more. And so when Mr. Noyola says he wants another report or another, I don't really know what we'll be talking about insurance. From now on, when we present it, we're going to present it as absorbed, unless this board
I think
wanted
he
us
just
to.
means, what happens the following month. Is it still the same doctors, the same medical, what are the changes from this report?
Okay.
But,
Oh, I see what you're saying, as a result of our new plan. Whatever new.
no, just as a result of time.
Okay.
So how much per employee, what will that translate to, the 384,000? What do we currently provide for each employee?
Can I call up Ms. Pena? Do you know the answer to that question? Or Ms. Ayala? I think it's 334 or
I thought I read 356 on that.
356.
It's on the previous one.
Okay, it's in our website. Let me get it.
We really hadn't calculated, if we were to transfer that 384 to the employee, we haven't calculated what that would be for each
We
employee.
didn't calculate what the impact will be per employee if we were to transfer that cost to them. But-
Well, I didn't say if you transfer to them.
Oh, the
What will
increase.
what will the contribution per employee be if we do if we cover it?
Yes, how much will that go up? Yes, the employer contribution.
No. Our share of it.
Right, so whatever we currently contribute to each employee, if we absorb it, then you want to know how much that contribution will go up. Right. Good question.
Our employee contribution right now, it's $336.17. It's up in the screen. And it depends on the type of plan that the employee joins, that they pay out of pocket.
We can calculate that, though, exactly.
Let me see if I heard this correct. You mean they don't all get the same amount of contribution?
Yes,
Yeah,
everybody gets $336.17.
Okay. So we have an idea of, then that's what I was asking, how much will that contribution be if we cover the $384,000?
Do we cover how much that translates? Yes. It could be $350 or, we work on that number.
We'll calculate the exact number.
Yes.
Okay.
We'll work on that number.
Any other comments or questions regarding our health
Just one,
insurance?
just one more, I mean, if I could, I think the most important thing to look at this, and, you know, looking back 3 years into getting this done, is one of the saddest things that I remember about this is that everything that we'd give, mostly, the majority of the increases in pay that we would give to our employees was going directly into insurance back in the day. And now, I'm hoping that this last year and this year, whatever we decide to put goes directly into their pocket and not into insurance increases. And I think that was the reasoning behind going self-insured, so that the employees can feel that they're earning money and that they're getting raises and that they're getting to spend those raises, instead of it as it was 5, 6, 10 years ago, the way the insurance companies were going, was basically any raise that they would get was going straight into the increase in insurances. So my thinking is that, you know, whatever we're going to do this year, and if we can absorb the new cost of anything that happens, 1 or 2, 3%, whatever it is, it benefits the employee, because any raises that you give this year, if any, go straight into their pocket, straight into consumption, and straight into the economy.
If I may add one more point, the 3.52% that number came from adding that to both employer and employee contributions. So if the employer was going to assume all of the increase, then of course that percentage would be a little bit higher. We could get that over to, before you start your budgeting cycle, so you know the exact amount. So for example, we need the plan is calling for a 3.52%. That would be if we added the $336.17 plus the $60.72, for example, on that particular plan. So it's taking both numbers into consideration. It's on the whole.
Next item.
Good, right? So this is good, right? We should be happy about all this. Everybody's looking down and out.
Yes.
This is very good news.
This is good news.
This is good
yes.
news. Okay.
It is all good news. You know what? It's a good plan that we put together.
Yeah, very good
Good
benefits.
for employees.
May I proceed, Dr. Moreno?
Yes.
Item number 1, thank you, Ms. Holguin, appreciate
Thank
you.
you very much.
Thank you.
You.
Excellent job, by the way.
Ready? Should I begin? Okay, moving on to item number 1, discussion and presentation to approve and/or ratify the monthly disbursements for December 2015 at the regular board meeting. Total cash disbursements were recorded at $19.1 million, of which 14.5 was related to payroll costs, and 4.5 million was related for the payment of goods and services. May I move forward, Dr. Moreno?
Yes.
Item 2 is the discussion and presentation to approve monthly reports and/or other updates and reports. I don't have a link.
They're not on there.
I'm gonna, yes, it's here, but I just have to search. They're not. I do have a hard copy The links are not there.
That's the one I download from.
On the website?
Let me,
Do you want me to try it in?
I'm gonna move it.
This is the packet.
Yeah.
Some music? Dun, dun, dun. It's too quiet in here.
I think we had more people at the Nixon Martin game at the United Alexander.
Yeah, I saw, I didn't go to the game, but I saw in the bleacher, they look kind of empty. You went to the game, no?
No.
Oh, you didn't go?
No.
Wow. You didn't go see, did Mr. Martinez go? Did you go to the Alexander United game?
I went
Basketball?
Saturday.
I went to the dance.
Oh, that's right. Yeah, you already graduated? No.
Yeah.
Some rap music.
This is the one Servando sent me.
So, function la posada?
When? Election? Next weekend. Next Friday.
Not this Friday.
Yeah, we can go get copies now if we don't have,
Or just go down the line, no, the way you usually do it.
It doesn't matter, just go through it.
Number,
I think you have some.
This is what we'll do. Dr. Moreno,
Just go through it.
if I can have permission to go to another agenda item while they get that working or get
Or
copies
just go
or
through
do
the
whatever.
numbers, it's okay.
Yeah.
Well, for the public though. So let's just go over a couple other, we got
Okay.
some major
Should go,
agenda items
yeah.
we can be talking about.
Absolutely.
So if I may have permission to move to item number 6. Item number 6 is the update on town hall meeting held on January 16th, 2016. Dr. Moreno, members of the board, we just wanted to communicate to the public that we had a very successful town hall meeting on January 16th. I would like to thank Dr. Moreno and Mr. Garza for taking time out of their schedule to attend the event. I was at the Civic Center, and basically, we covered 3 main areas. Chief Palomo opened the presentation and went over our update on the open carry legislation. And we've still been receiving media requests to clarify some of the things we've communicated to the public, and that's still an important issue. The other thing we talked about was led by our Chief Officer for Communications, Ms. Castillon, basically talked about communication and introduced a new tool that we have to hopefully garner higher levels of public trust called K-12 Insight. And she had several things that she presented under the umbrella of communication. And then finally, we spent most of our time really working on student achievement and making the community aware of the PEG list and our school's focus on academics. So we just wanted to put that in the record. I personally wanted to thank the Office of Communications. Also wanted to thank the Office of Student Services, specifically parental involvement and the parent liaisons. And it was just we had over 750 registered parents. And Ms. Martinez served as our translator in the event and did an excellent job. And so we hope to do more of that community engagement. Any comments or questions?
Yes, I have a comment.
Yeah.
I just want to thank everybody that was involved in getting this together. And I think this is a good avenue to reach our kids. And we need to put people there so that they can work with parents, because we don't have the parents, we don't have anybody.
Sure.
And I think we need all the help we can get. And if the parents are involved, then we got a good crowd. Thank you.
Yes, sir. Any other comments or questions?
One big point that came out of that meeting that I liked was that, and I agree with Mr. Perez, because it had, a lot of the time that we were we were noticing, or you had noticed that, and Ms. Castillo noticed that, you know, we were pretty much preaching to the choir. Those are the parents that are usually more involved than any other, in all the schools. Those are the ones that go to all the PTA meetings. Those are the ones that are, but one very important point that was brought up by you all is that you sort of put it on them, that they also have to get all of those other parents that don't join anything, that do not appear anywhere other than to drop off the kids and go home. Those are the ones we need to reach the most. I think those where the problem areas exist. And
Yes, sir.
y'all made a very clear point of that, and I appreciate that.
May we proceed?
Yes.
Item number 7 is discussion and update on performance objectives. You know, in the interest of time, I just want to be clear, we've been discussing this at our committee meetings, all of our, at Student Services, Operations, and Curriculum and Instruction. We hope to establish performance objectives as metrics to evaluate our programs. And each department has a little bit different assignment, but we just want to communicate to the board that we accept this challenge, an opportunity for us to really document our effectiveness or lack thereof. And so we're working on that. Human Resources is working on a very detailed set of performance objectives for human resources, finance, the whole 9 yards. And so since we started the good conversations, it's really the brainchild of Dr. Moreno, for the record. We also wanted to say respectfully to Dr. Moreno, we've been using the term performance objectives in our district improvement planning for years now. And so we're kind of having to retrain ourselves to align what we've been saying with what we want to be saying. So are there any other comments or questions as we move forward on performance objectives?
Go ahead.
If not, may we have permission to proceed?
Yes.
Item number 8 is discussion and presentation on the creation of 2 committees. One is the Health Insurance Board Committee, and the other is the Facilities Naming Board Committee and the appointment of board members. Dr. Moreno, members of the board, first of all, on the Health Insurance Board Committee, this is a committee that we've used at different points in different years, but as a self-insured model, we haven't had the need to review who our health insurance consultant is. And so now we're at the point where we need to bring those respondents to the RFP before a committee of users and an identified board committee. The appointment of that committee is the responsibility of the board president. I believe she's already spoken and asked Mr. Garcia to be the chairman of that committee, and for Mr. Garza to serve on that committee along with the board president. And so the chairman then will identify what criteria he wants to establish for that committee and how the process will work. But we're hoping that that committee can make a recommendation to the full board regarding our health insurance consultant services.
And as always, all other board members are also invited to
Absolutely.
come to all our meetings.
And we'll send out a memo after this has been approved, but policy requires board action on that. So then moving to the Facilities Naming Committee, if you'll note, back in December, we had an update on facilities naming and asked trustees to start thinking about recommendations they would like to see the Facilities Naming Committee discuss and eventually bring as a recommendation to the board. So we've had that open now for 2 months, and as part of our process to come to some recommendations, we'd like to really follow our policy and have the board approve the Facilities Naming Committee that the board president will appoint who she decides will be on the committee. And so, Dr. Moreno, I'm not sure if you're prepared to say who will be on that committee at this time.
Well, I was going to follow the same
we've
thing
done.
we previously had, which was the board officers to serve on that committee.
The
I think
board
that's-
officers.
That's what existed before.
And so really then it's important for the entire board to know that if that's approved this Thursday as presented, then I would like to recommend that we open, okay, in March, we're asking, but before the regular board meeting in March, that committee will meet and review all names submitted and make some decisions about a recommendation to the board in March. So really, I would say that each board member has until, let's say, March 1st to put in any final recommendations that you would like to see We'll prepare all that, our office will prepare all that and meet with the board officers, and the board officers will make some type of recommendation in March.
Mr. Martinez?
I believe the first step is to name the facilities first that we're going to be naming, and then after the facilities are presented to the board members, then the board members will bring in the recommendations for what names to give to each of the facilities. So the first step is to name the facilities that we're going to be naming, and then from there,
So we just need to have, if anybody has suggestions of any facilities, to turn those into Josie.
let's do that first, okay? So then for clarification, facilities that trustees think should have a name is what we're opening
right,
by March 1st,
okay.
all right? So, okay,
The suggestions go to Josie.
suggestions go to Josie by March 1st, and the officers will meet and have an update in March. Okay, that then brings us to item number 11. And here's what I would like to say on this one real quick. For the record, discussion and presentation on the current year estimated excess revenues over projected expenditures based on the mid-year budget review. So we have approximately how much in the mid-year review, Ms. Ayala?
With AD at 22,400, about $2.6 million.
So we have here's what you need to know on item number 11 so that the board can make an informed decision. As we go annually, we have a mid-year review. And in our mid-year review this year, we've identified $2.6 million in excess revenues. In my humble opinion, we can use that for one of three options. Number one, we could take that 2.6 and, according to our policy, move it to the central office account. And that's what we have been doing with excess revenues. So that's one. I can't say we've always done that, because just in the fall, we identified some other priorities and we did that. The second priority that, in my opinion, we should consider, and it's in a subsequent agenda item, but we currently have on the table a renovation to Veterans Field at approximately 2.4 or 2.2 million, something like that, 2.4, and then a $275,000 upgrade to the Aquatic Center. And we'll go over that presentation, but that would basically take care of the 2.6 million. The final idea that we wanted to bring, just to give the board some options, is you're going to see that as we go through the budget, we really only have, let's call it a couple of million for salary increases. And so one option for the board is to increase that by 2.6 million so that the board can have more salary.
You can't use it for operations.
Ms. Ayala?
Well, those projections are based on, I believe, we did consider a decrease in the ADA, but our special pop counts are increasing, which kind of offset those numbers.
If you have savings in salaries,
And we do.
the savings will automatically be money you can reappropriate next year, but it won't be this money.
That's fine. I understand your perspective on
It won't be this
that.
money, but it will be
Okay.
the equivalent of this money in next year's budget.
Let me, I
see
guess,
your point.
clarify. Yes, right now, we did identify $2.6 million and more once we updated our numbers based on facts that we already know based on PIMS, right? So when we prepared the first draft of the projected budget, we considered the old numbers. So if we are to update those numbers with the current numbers, obviously you're dealing with the same revenues, adjusted by what we know in the Austin yield, those increases and whatnot.
Right, but you can't go in, let's just say we spent 15 million in salaries. You can't go in and say we're projected to spend 13, because you really didn't spend the 15 this year.
I see what you're saying.
And the money is there, but it's not this money, it's the equivalent of this money the following year.
Even though some of it's from salaries, a lot of it. like
Right.
Most of it.
Well, our projections were based on revenues estimates, not necessarily expenditures. So we do have savings down in the expenditures, that's in addition to the 2.6.
Right. So when you bring us the budget, don't tell us the salaries are going to cost the very same thing that were
Right,
budgeted
that's
this
generally
year.
our preliminary until the board determines.
But that's where you get your additional money right there, when you bring us an amount that is truer to what it has been.
I see what you're saying.
Yeah, 'cause
So
you-
based on that, then the central, go ahead.
Go ahead,
Mr.
finish
Kirsch.
your
Well,
thoughts.
based on that, then the two recommendations we have is either putting the money into the central office fund or the sports package that we'll be talking about in a subsequent item.
Let me ask you, but you're, if I got it right now you're projecting a 2.6 based on salary saving.
No,
No,
on
there's-
revenue
is there a
estimates.
combination of stuff?
Right now, we are not considering savings in the expenditures in the lower portion. This
Right.
is just basing ourselves on our template and on student counts.
Additional
And what we
revenue?
came out initially with our revenue, it changes by 2.6.
But is it,
We
a
have
new-
2.6.
is it, Dr. Moreno, is it new revenue or is it revenue already projected within our budget? Because if it's new revenue, then.
Yes, no, it is new. It
It's
is
new.
new, right,
So it's
because we
new
prepared a
revenue
balanced
plus-
budget.
Plus whatever we did on savings too.
I'm sorry?
It's new revenue plus whatever we've saved from,
We're not looking into savings in expenditures yet. That's
So if
just,
it's
Not yet,
new,
okay.
so if it's new revenue, you would anticipate that same revenue would come next year?
correct,
So that's when you get
based on
to
our
have
current
it
counts,
as
yes.
extra revenue.
Okay.
That is why, right.
thanks.
Understand.
Makes
So we don't have to make that decision tonight, but this sports package that we are recommending approval on does need a funding source. And so that's one way to fund it and keep the momentum going.
Right.
Okay. Just to get one more in real quick before we go back to the normal items 1 and 2. Item number 12 is discussion and presentation to adopt a resolution regarding cyberbullying recently approved by legislation. You don't need any update on this. It's been in the front page of our local paper and it's been a state and national topic. And basically this recent legislative session increased the severity of cyberbullying. And it expanded it to where it's no longer just what happens at school. So you can be on social media and all of those things are Class B misdemeanors now, and we're trying to really get aggressive, like our some other districts that we know, in getting the word out and communicating that cyberbullying is not going to be tolerated. And we're asked the board to approve this agenda item on consent agenda. Any comments or
Ms.
questions?
Moreno?
Yes, Mr. Bettis.
Yeah, whether it's cyberbullying or any kind of bullying, I think when we have all these policies, and I think it's to start from the board down, trickling down to the students. Because I know for a fact that sometimes professionals get out of line, and they humiliate people, and they go on a rampage. And I think we need to be very careful, Dr. Nelson,
Yes, sir.
that we take care of business. And it goes, we have an ethics committee for ourselves, and we need to follow that too. We need to be an example for everybody. So I'm just urging that everybody do their thing and do it right. Thank you.
Thank you.
Thank you.
All right, so with that, I think that's a good stopping place. We'll come back to our footer items, and I'll allow Ms. Ayala to take us through our first
Item number 2.
agenda items, 5
Yes.
agenda items.
Thank you, Dr. Nelson. Going back to item number 2, I'll be presenting the highlights of unaudited financial statements, and this is as of December 31st, 2015. Under donations for the month of December 2015, we recorded $12,842 for that month, and the fiscal year-to-date donations amount was $51,346. Under our revenues, the month-to-month comparison, we recorded $21.6 million, which is 10% or $1.9 million when we compare it to the same period in 2014. And moving on to the year-to-date, we recorded $94 million, which is 9% or $7.3 million more compared to the same period last year. Here we have the tax collection summary. For the September to December collections, we recorded $19.2 million, which is about 68% of the budgeted amount of 28.2. Then when we look at the October to December collections, we recorded $19.2 million, which is also about 68% of the adjusted opening levy of $28.4 million. Under the expenditures by object, we recorded total expenditures for the month of December, $15.2 million, which is about 1% less than the previous year of $15.3 million. We spent $145,000 less. Yet, when we look at the year-to-date amount, we have incurred $68.8 million, which is 5% or $3 million more when compared to the same period last year. Here we have those same expenditures by function.
Ms. Ayala, can I ask a quick question? Two slides back in revenue, you said we had a $7 million, 9% from the previous year as the
Correct.
savings.
Not as a savings, we are collecting more.
So it's new revenue. Well, it's not new revenue, no, because in collecting, we're down by, I would say, what, 2%?
1.2 million. And
Right.
that's because of the permanent school fund. We got less this year. So that's one of the impacts. That's why you see that negative.
But it might
Under-
change from last year, we're ahead
We're
of last year by
7
$7.3 million.
That is correct. And that is noted by an increase in the foundation payment of $1.4 million.
So what effect does you say if we have a $2.4 million surplus, but really, that's part of our surplus, the 7.3, because that's something that we didn't have last year.
Well, that is a projection based on student count.
These are true numbers.
The state portion is based on the cash payments that we get from the state,
Right.
based on their estimates. And then in August, once we close the book, we reconcile and record the actual amount, and that's noted in the audit report.
But if the
We would
trend
get
continues the
less.
way we are going to have more than that particular savings, because we're showing that now, so that's.
But that was already into the budget.
Right, but we're not, it's already in the budget, but it's money that, by last year, we already had spent it, the state had sent it back to us anyway, and it wasn't a surplus of money. Now it's actually showing as a surplus of 7.3. Right?
I got a little bit.
It's a change, but not a surplus.
Well, not a surplus,
It
it's
is,
change, but it's more
right,
revenue.
because the basic allotment increased from last year, so right away, that's going to give us additional
So
funds,
it's,
right?
so it's additional
That's
money.
reflected in that increase, if you will, yes.
Okay, so it is, that's what I was saying, so it's a surplus, it's extra money that wasn't really allocated, or really wasn't
But we
planned.
did budget it, yeah, it's in the
How can you budget
budget.
something we don't know we're gonna
No,
get?
Yes, we did.
We had already, we knew we were. That's
When
where
we,
this-
when we created the budget, we created with the increase in the basic allotment in mind, so that's how we estimate our revenues.
I understand.
Thank you.
You're welcome. Okay, going back on expenditures by function, we spent $42.1 million, or 61% of the total expenditures in instructional services, which is function 11, followed by plant maintenance and operations in the amount of $6.8 million, or almost 10% of the total expenditures. Under other financing sources and uses, we transferred out $965,000, which is $88,000 less when compared to the same period last year. Here we have the administrative cost ratio, the standard being 11.05%, the amended budget 8.24%. Our fiscal year-to-date ratio stands at 6.52%. Here we have, again, the general operating fund in summary. The time lapsed has been 33%. Under the revenues, we've collected 46.63%, and our expenditures and encumbrances, they represent 36% of the amended budget of $202.9 million. Here we have the Child Nutrition Program, Fund 101, again, time lapse, 33%. Revenues, $7.4 million, which is 38.93% of the amended budget, or the original budget, and expenditures and encumbrances representing 61.77% of the budget. Here we have the E-rate fund. Total revenues earned, $53,000, less than 18% of the amended budget of $300,000. And expenditures of $265,000 with encumbrances of $512,000, whose sum represent about 18% of the amended budget. In athletics, Fund 181, total revenues $149,000, which is about 74% of the amended budget, original budget, and expenditures of $428,000 with encumbrances of $194,000, the sum representing 42% of the budget. Here we have the debt service. Revenues generated $18.8 million, which is 70% of the budgeted amount, and expenditures of $3,300, which is less than 1% of the expenditures. Next, we have the special revenue funds. If you have any questions, hopefully I'll be able to respond. Ms. Cortez is out on a training.
By the time you said it's barely getting around.
Any questions?
No.
I'm trying to.
It hasn't got to us yet.
So on the last slide is the summary of construction projects. Here, as you note, we have 3 outstanding series still open, and hopefully we will close the 2005 and 2006 series by the end of this year, possible. We have $40.9 million available under the Series 2014. Any more questions? May I proceed, Madam
Yes.
Board President?
Yes, yes.
Item 3, discussion and presentation on the following budget amendments. BA 1516-27, discussion and presentation to approve the general operating fund budget amendment in the amount of $104,426 as a result of transfers between functional expenditure categories from the Board of Trustees discretionary funds.
I have a comment.
Mr. Perez?
Well, not a comment, but a request. I would like, I don't know if it's too late, but I want $2,000 from my account to the special ed at Cigarron High School. I don't know if the process, it's already gone, or?
Yeah,
We can
make an
include it for the
amendment.
regular
Right.
board meeting if the board so chooses.
All right, we can make that amendment at the regular board meeting, no problem.
From 104 to 106, 426.
It will increase to 106, 426.
Thank you.
The expenses allowed, right? I'm sorry. Going back, pending allowability of the activity. I didn't ask. Item 3B, BA 1516-28.
So what, did you understand that, Mr. Pettis? What she's saying is that without knowing the actual activity that the school will be doing with the $2,000.
Well, the thing is that,
assuming she would be
Right.
able to support it.
the thing is this, I really don't know. But, you know, every time we say, well, they don't put any money for the special ed. So in actuality, I don't know where they're gonna use it, either for travel or bowling activities or no. That would, the principal would have to decide that. But all the time we get that we don't give.
We'll have
the-
that before we bring it Thursday. We'll have
Okay.
a specific-
Yeah, because actually, I don't know where exactly a line item it would be.
Sure.
Okay, thank you.
We'll think of something. Item 3B, BA 1516-28, discussion and presentation to approve the general operating fund budget amendment in the amount of $114,625 as a result of transfers between functional expenditure categories to address needs identified on the capital improvement plan for year 2017, contingent on board approval of agenda item number 19.
So
Why
it's
would it be
actually,
for year 2017?
it's actually right now. It's for now. And it's not agenda item number 19 anymore. It's a different item, but the bottom line is on this budget amendment, and we'll clean it all up, but the $114,625 is amendments to the current capital improvement plan that we want the board to approve so that we can go get them done this year. And so you see the amendment here, and in an agenda item later in this meeting, we're going to go over the capital improvement plan and the $114,000 worth of items that we're wanting to move up, so to speak. Marquee, Mr. Garza, that's just one of them, but, so that's what that is.
Yes, and I apologize, it's for the current plan,
2016.
it's 2016, and we're reallocating savings.
I know the board doesn't like when we do this, but I'm going to ask Mr. Angel Velasquez to go ahead and hand out the capital improvement plan, since you have it. And you can be looking at, it's about 4 different versions of the capital improvement plan, so I just want you to,
Are we highlighting what is being moved?
it's all highlighted and all clear.
Okay.
Just, if you'll just let us it's going to take a few minutes, so we'll just continue to go through our
Go ahead.
amendments.
And it's not moving, Mr. Perez, once we go through a purchase, sometimes we overestimate, and there might be some funds left over, so we're bringing up a project to fund it.
Okay,
And
that's
there's
fine.
recommendations there.
Thank you.
Next item.
3C, BA 1516-23, discussion and presentation to approve the general operating fund budget amendment in the amount of $16,785 as a result of transfers between functional expenditure categories. Item BA 1516-24, discussion and presentation to approve the 2014 Bond Series EDA budget amendment in the amount of $19,600 to allocate funds for moving services for the final phase of Maribel B. Lamar Middle School. Item 3E, BA 1516-26, discussion and presentation to approve the 2014 Bond Series EDA budget amendment in the amount of $500,000 to allocate funds for the pre-construction expenditures for the Performance Arts Center renovations. Item 3F, BA 1516-26, discussion and presentation to approve the Capital Projects Fund budget amendment in the amount of $887,375 to appropriate permanent school funds and to allocate $12,610,662 for the new administration building location. We're moving the funds to the construction projects budget.
Ms. Ayala, I'm
Yes,
sorry, on 3E, the Performing Arts Center renovation, what Performing Arts Center?
That will
Sorry.
be the Civic Center, the Performance Arts Center. What expenditures? This is
Yes.
so we can start spending money on the drawings, I would think.
Drawings?
Tennis courts. It's for the tennis courts.
500, is it for,
Yeah, drawings of what?
The tennis courts.
Oh, tennis courts, okay. That's not the Performing Arts Center, this is the
Well, it's part of
tennis
that whole
courts.
project, but yes,
That's the only project we're looking at right now,
that's
right?
it.
Just tennis courts that were approved by the board.
we'll go ahead and reword it to be more specific. Item 4, discussion and presentation to approve and award the following bids, proposals, quotation, and contracts. 4A, this is a renewal, RFP number 15-006. This is for removal and installation of hardware. The Evaluation Committee recommends renewing of the contract of 2H&H Door for an estimated amount of $162,000. Item 4B, this is also a renewal, TASB Buy Board Co-op vendor number 487-15. This is for instructional materials such as TEACS and STAR. The Evaluation Committee recommends renewal of the contract to Dynastudy and Jared Publishing Company for an estimated amount of $140,000. Item 4C, renewal, TASB Buy Board Co-op vendor number 449-14. This is for instructional and staff development materials. The Evaluation Committee recommends renewal of the contract to Barnes & Noble Booksellers for an estimated amount of $150,000. Item 4D, RFP number 15-045. This is for the construction manager at risk services for the Performance Arts Center, Martin High School tennis courts, and baseball complex. The Evaluation Committee recommends awarding a contract to Leindecker Construction Company for an estimated pre-construction fee of $5,000, general conditions of $644,000, and 2.3% of the guaranteed maximum construction price, which represents the best value to the district.
Why would they not identify the cost until it's 75% completion?
In order to do that, I believe they need drawings at 75%?
So do you mean completion of the drawings or completion of the project?
Yeah, once the specifications, and it's there, the guaranteed maximum price will be presented to the board once construction documents and specifications reach the 75% completion level.
So it's once the documents read the 75, okay.
Yes.
But let me ask you, just out of curiosity, why would we not, instead of a construction manager risk service for the whole project, why would we do that just now instead of in pieces? So it's already in place
For the whole master plan?
for the whole master plan, because it's only, you're gonna bring it back to another, for the auditorium.
No, but it's
No,
there.
this is for the auditorium.
Risk for
This is for everything.
PAC. There's
For the
PAC.
Performance Arts Center, Martin High School tennis courts, and the baseball complex.
Right.
It
And
does
the
not
only reason
include
I say that because
the ballroom.
the baseball complex is not part of the, well, it's a part of the master plan, you're
Four
right.
corners.
Okay.
Yeah.
Well, but what has been approved by the board? So far, the tennis courts is the only thing that's been approved by the board.
Right. The only thing about that is that we know that we're starting with the tennis courts, and we fully acknowledge that this board has not given us direction on anything else. But we do know that at some point, we're going to have construction happening within the four corners. And what we're proposing on, really not just this agenda item, but in general for the public, that we have a construction manager at risk that does the construction.
Yeah.
And I think everyone can agree that even though we hadn't decided on the scope of the project, we do know that we want to have a
Okay.
construction manager at risk as our construction method.
Okay, that's the only thing we're getting,
That's all we're
construction
asking for,
manager.
yes.
Okay.
Item.
Item 4E, RFP number 15-046. This is the construction manager at risk services for the early childhood centers and Sierra Middle School expansion. The Evaluation Committee recommends awarding a contract to Leindecker Construction Company for an estimated pre-construction fee of $5,000, general conditions of $508,000, and 2.5% of the guaranteed maximum construction price. Item 4F, RFQ number 2014-009, Professional Environmental Consulting Engineering Services. This will be for project number 5, LISD PAC existing facilities and master plan improvements, and project number 6, ECC renovations and Cigarroa Middle School expansion wing. The Evaluation Committee recommends awarding contracts to Castle Engineering and Testing for an estimated amount of $224,550 for Project 5 and Terracon Consulting for an estimated amount of $14,170 for Project Number 6.
Question here. This is not a renewal,
No,
so why is
We-
it a 14-year?
because
RFP?
that's when our original RFQ the list got selected?
In other words, we've already used this RFQ to award other work, right?
Yes.
So how are we using it again? I mean, what was the,
Yes, ma'am. For the record, Gustavo Alcanta, Procurement Director. Yes, you are absolutely correct. We have used this RFQ in the past to award work, but part of the condition, the instruction that we received from the board is that any time that new projects come up to be awarded, that we present them to the board for approval.
right?
Yes, ma'am.
So the next question I have is, how could we evaluate the responders differently based on the project? I mean, these are qualifications. They're qualifications to do this work. The work is all very similar.
Yes, ma'am.
Why would it be different? I mean, I understand selecting different vendors, but
Yes.
I really don't understand what's happening here.
We approved
I
a-
also noticed in one case, two of those that evaluated had the exact same score and everything. It almost looked like they copied from each other. And, well, I'm
Well,
just
to
telling you.
address your question, ma'am, the board did approve a pool of 3, in this case, in
To
item
use
4F.
it- to use for all of them.
To use
But-
for all of them. So when a new project comes up,
But you know, there's no way that the amount of work is being distributed anywhere close to evenly, anywhere close. I mean, even here, it's 224,000, and the next person gets the 14,000, and the next one gets a 6,000 job.
yes, ma'am, because whenever a new job comes in, to be done, we call an evaluation committee meeting, and then the evaluation committee meeting, based on their experience, picks the firm that they believe will do the best work on this upcoming job. I really can't do we've discussed this with legal counsel, we can't do a rotation where everybody gets the same amount of money. It's based on the recommendation of the evaluation committee. What firm will do the best work based on their qualifications and experience?
Well, I'm just going to say that I'm going to ask the rest of the board to be sure you look at your backup on that. Just look at what you can see and see.
Can
if
you,
think it
can
looks
you
like-
identify, maybe this'll,
I'm sorry.
identify, and I think we need to do this because and I hear you 100% clear on what you're saying, Dr. Moreno. Whether or not the engineering firms that are coming in are all doing the same thing, the same project. For instance, you have project number 5, 6, and 7. If you look at it, it's project 5, 6, and 7 for both RFQs are coming in the same line where Castle gets in first, the other person gets in second, and the other person gets in third. And correct me if I'm wrong, Dr. Moreno, are they all bidding out on the same, not the same amount of work, but on the same type of work? You know what I'm saying? It's not whether or not, are they doing geotechnical, are they doing site-based analysis, are they doing material analysis, are they doing civil engineering? And so are we basing that criteria on all those 4 things?
Yes, they're chosen based according to their qualifications.
Because if we did that, then firms number 2 and number 3 will always going to come in second and third because the bulk of the work is going over to one person based on the criteria of the evaluation committee. In other words, if there's an estimated number of points that you get for the amount of work that you do for LISD, then it is obvious that firm number one is always going to be on top, because they're always going to have most of the work. And so, I don't know, we need to revise that process or not, but it just so, I'm not sure if it's always the same person getting the higher amount of work. And I think that's the concern that I've heard over the last 3 or 4 years from this board.
Me too. Was, when you look at the document that our executive assistant just handed you, you see some awards that contradict that finding.
Well, only because we decided to put everything on a rotation 2 years ago. That's why you find the contradiction.
You don't rotate, you select them from the pool.
No, I mean, but there's work that we rotate when it's needed, and there's some that you collect from a pool. I think that's the way this board had said that we were going to be doing it.
We can rotate.
We can establish a pool, and then the evaluation, the system in place is that we establish the pool, and then the evaluation committee makes a recommendation as to which firm would be best suited to do that project. And, well, let's say, for instance, that item number one, that the firm that got the first one decides not to meet the scheduling requirements of that project. At that point, you get to go to the second person.
Yes, sir.
Is that the way we were talking about?
Yes, sir, and you would...
That's what I meant by rotation.
Yes, and then you continue, if the second firm, for whatever reason, can't meet it, then you'd go to the third and so on, till you have a successful contract.
And this is how we have used that RFP completely. This is everything on that RFP. Okay.
Thank you.
Now, let's, okay, so for a second, just so we can be clear.
Sure.
So then, if the project is going to be done by a certain architect, let's say Lamar, right now, they have their own engineers as part of their work site and what they're going to do. By law, or by rules that we follow here at LISD, LISD has to have their own firm also do part of the testing, so they can both meet the requirements. So it's a checks and balance type thing. Is this what this is?
The second item, no?
Yes, the second material testing.
The material testing alone? That's what it is, sure.
Just for clarification purposes, Angel Velasquez, many times we are in the situation of the committees, in the situation of awarding a contract to more than one company. The one thing that we need to look for is basically that if the civil engineering that the architect is getting directly is under X company, and it happens to that company not only provides civil services but also geotechnical, it would be kind of conflictive to have the same company doing civil work and this same X company doing the testing for the civil work.
No, yeah, I agree with that. That's not a problem. My problem is, or my explanation that I need is because it's kind of conflicting, and I've heard it from some of the board members already, that we're hiring, the architectural firm brings their own engineer and their own team, and then we hire these companies that we're looking at right now to go and confirm the work of those companies.
Correct.
Okay, so that's really hard. That's why we see a bunch of names coming up and down from one side or the other.
As a reassurance of that they are.
So we can keep the integrity of the projects going, the integrity of so we can clarity as to what is going on. So we have one firm that represents LISD and one firm that represents the architects.
Mr. Velasquez,
Yes.
wouldn't that be the same thing here? If the same firm is getting the same project, they'll do the consulting and then they'll do the material testing both? That's not a conflict?
Well, the page that you're looking at right now is, and sometimes like some firms, like I can tell you that like Howland, for example, they also provide civil engineering.
Right, but right now you said that whoever does the testing should not have been the one that did some other work, right?
Yes, civil, for example. Civil is not here.
Civil's not here?
No, this is just geotechnical and environmental, that is...
So these two don't conflict? They can do both?
No, these two don't conflict. Yes.
Any other comments or questions?
That's all.
We'll continue to look at that.
Does it mean that we have an open PO like that?
4G?
We never get a result.
RFP number 2014-010, Professional Geotechnical and Material Engineering and Testing Consulting Services. This is for project number 5, LISD Park Property Improvements, Martin High School Tennis Complex, and Veterans Field Parking Lot. Project 6, ECC Renovations, Additions and Ciudad Middle School Expansion Wing. Project 7, Asphalt Seal Coat. Project 8, Gallego Elementary Canopy Expansion. The Evaluation Committee recommends awarding a contract to Castle Engineering and Testing for an estimated amount of $305,550 for Project 5. Castle Engineering and Testing for an estimated amount of $188,875 for Project 6. Terracon Consultants for an estimated amount of $61,175 for Project 7. And Carrillo and Associates for an estimated amount of $6,149 for Project 8.
So when we awarded this contract, have we ever extended it?
No, it's on a project
So why are
basis.
we, I don't understand how we're using the old RFQ.
The services, the pool, if you will.
If I may-
Without asking others, without putting it out again.
I see what you're saying, it's just, this is such a technical consultant that, you're right, we probably should check, it's 2016 now, we've been using this since 2014, so if that's the will of the board now, Mr. Garza, correct me if I'm wrong, because I know you're our de facto expert on this, but seems like Terracon, Carrillo, and Castle, if we opened it up, are there other, I guess my question is, are there new companies that have, I guess that's why we would post it.
Well, so we're
To
post,
see if
we
there
have
were
no
other
idea.
people out there.
If we have the same gene pool, we're just gonna continue to, go
So maybe
through
for a year, it would be okay to use it for 2014.
Well, it's because in some cases, some people say, I don't choose to bid on this project because I'm overwhelmed with work out here.
I have work, right?
At work, and so, but if, and I know we send it out to everybody anyway. I know that's the process, but I'm still confused kind of why we're using the 2014 RFQ processes to get this thing done.
So I hear the board saying,
Because it adds that.
I guess the question is, have we procured this legally?
Yes, if,
all right, we'll go back and take a look at that. Part of it.
I don't want to slow down
It's
the
not,
project
it's not personal. It's not about the department. It's, the question is if we were to go back out and reissue this RFQ to see, and would it create any type of undue hardship on the development of the project? And the answer is yes.
Right now,
So having said that, we'll have an update by
So-
Thursday.
So, you could have brought it in as a renewal, maybe, I don't know. I don't know what was written into,
But not the way it's written.
not the way it's written.
Well, the only thing that the red flag is you're giving one project, and it's a fair project, which, it's a fair evaluation of distributing, but you're distributing one of almost a little over 700,000 to one particular company and just 75,000 to another company. Where's the fairness in that? Explain that to me.
I don't know what it is.
awarding different amounts of.
There's no
well,
explanation.
we're waiting, those are the recommendations of the evaluation.
Oh, I understand that, but still, the evaluation does not mean, just because it's coming from the evaluation, who cares? It still doesn't make sense. It's just, that's just a recommendation, but still, where's the leveling on this from almost a little over $700,000 to not even $75,000? There's no
Balance.
balance. And I don't know who that company is, to tell you the truth, but
In other words,
know-
what is the 188, and, and I think what everybody's is saying is, are we putting in the ECC projects only to Castle? and the asphalt seal coat in Gallego over to Carrillo and to Terracon. Is that the way we're breaking it down? In order for them to get
Yes.
to those
They
numbers?
don't do that other work
And
or what?
basically, one of the reasons that the committee takes in consideration is, the capacity of the firm, because at any given time during the course of the project, you're gonna need to be like, doing the borings at, from one day to another. So they really need the technical personnel and the equipment to keep up with the pace. So that's one of the things that.
So, let me ask you, I'm sorry for this, so if you bring these companies in there and ask them, can you keep up with it, they're gonna say, no, I can't keep up with this, and I'm never given the opportunity. That's what I wanna know.
Yeah, and we look at the submittals, based on the personnel that they have, the equipment, everything is on the binders. So, the committee, at the end, comes with a recommendation based on the size of the project and the timelines and all those kinds of things,
But the committee's fed the information by you all. They're not experts to go and say what they actually do. So you all are feeding this information to your committee to make a decision. Yes or no? Like you're telling us, this is the way you see it, but that's what you're feeding us.
Yeah.
But these people are not here to defend themselves, to say, you know what, we can do it, but we never begin the
well,
opportunity.
in this particular
It's
case.
just information that you
yeah.
give to the committee, and the committee says, oh, that sounds good, yes, I'm with you. They don't really break it down, I
Yeah.
don't think. Because as son Dr. Moreno, the scores, they're identical. So it's just telling you,
In this particular case, we had in the committee like engineers that are not related to these particular areas. We have a structural engineer, we have a mechanical and electrical engineer as well.
so they know.
So, but, they are part of it, but,
Okay. It's lopsided there, just for the record.
But just look into the fact that it's the old
Yeah.
RFQ that we're using.
Yes, ma'am.
Let me ask you one last question on this, because I think I've asked it before, and I'm not sure that I got it very clear, understanding. When we're looking at the last column, it says historical expenditures for this RFQ are 603,540. Expenditures for this project are 561,749. I don't think we've ever gotten, and I'm sure, I don't know if you see it, obviously you do. Let's say this project, the estimated amount, let's say for this project by, let's say Terracon, 61,000, almost 62,000. Is that, and I think we called it before an open PO, up to 62,000 for them? Is that an actual contract for them for 62,000?
No, the contract amount is the amount we're presenting to you.
Right, 561, right?
Oh, no, that's the aggregate of those amounts. If you add 305.
Okay, yeah, that's what I'm saying. So
Yes.
when you go to project 7, let's say Carrillo, it says $6,100. Is this the actual contract amount?
Yes,
Or, okay, it is? So
Yes,
it's
sir.
not anything that we can say, the estimated amount is 305,550, the other amount that was there. Is it an up to that amount type figure?
no, at this time, those will be the purchase order amounts.
Right. Have we ever gotten one that's come below that, and there's changes that come below?
If they are, we
Because-
only
because-
allow like a 10% to negotiate, but by this time, negotiations have taken place.
Right. So we've never had one, sometimes when it says the estimated amounts are more or less, obviously, what
Right.
what you're gonna be getting into.
But pretty much when they're here posted, that is the amount we go through. They've been fully
And
negotiated.
it's only because we don't have any sets of plans written up yet, we don't have anything, we don't even know what any of this stuff is gonna look like, and we're already putting an estimated amount of what it's gonna take to get it done. I understand that they know that's part of their business, how many hours they're gonna be spending there, what the actual costs are gonna be to do that. But I'm always kind of weary about when we put expenditures and estimated expenditure amount, or up to this amount. And because we never receive a report that says, well, we said it was going to be 305,000, but it was actually 297,000.
Yeah.
And we never get to see whether they reached the limit or didn't reach the limit.
And you are correct, Mr. Garza. At this time, we don't have like firm prices on, I'm just gonna give an example that Mr. Martinez just mentioned on the pack. So as of right now, it's only the tennis courts. If for whatever reason nothing gets approved in the near future, the amount, it won't be that. So it's based on the general scope of work, but we process the work as we go. So
Can
in
you
other
just
words-
make sure that at this board, when those type of occurrences happen, that we say, that we at least get some sort of scheduling or time, or report on, hey, they didn't meet that. That way we have an idea what we're looking at.
Yes.
Okay.
We're not binded by these amounts.
Moreno.
Yes, Mr. Perez.
Can we go ahead and select, if somebody gets like a $700,000 contract and the rest gets 75 and 60, on the next time around, we'll let the other ones that were low get another contract that is bigger. Can we do that, or is it not legal? No?
Well,
what?
just very respectfully, Mr. Pettis, I'm uncomfortable with that because I agree that we want to be fair and transparent about this decision. And I think there's other ways we can present the information to the board that will satisfy your concern other than just having a round robin. I would say that there's a I don't want to mention any company's names, but I know that there's one company on here that their ability to do big projects is limited.
Right.
And so if you just say, well, they get the next project, they may not be in a position to meet the district's expectations. Now, your points are real clear. And I think Mr. Velasquez and myself understand, I know our internal auditor
The
can.
biggest concern is using that 2014.
Well, and using an old pool, and really, that's your biggest concern. I feel like the biggest concern is who's being awarded it, and why is one company getting such a large piece of the pie, so to speak. And I understand Mr. Velasquez's responses, and, technically, we should have, for the tennis courts, we've got engineering services as if it's all of it. Well, we hadn't got that far yet. So we could take out just the tennis courts, and it may just be a small award. So you have the fact that we're using a 2014 pool, and the fact that it looks like companies are getting, and especially when you start looking at the scores of the evaluation committee. So these points are all well taken, and Mr. Pettis, I understand, and just allow us to go back and present something to the board that makes you more comfortable.
I think,
in making a
if
decision.
we're going to do that, then let's just do this. Then we need to just get a better understanding. And it might not have anything to do with what we're doing right now. But because a lot of these things are arbitrary through some other people other than us, then we need to know that these people, number one, are qualified to make those recommendations. Number two, that the recommendation process is something that we all have to know what it's all about, how it goes, how do you go about this, what kind of questioning are you looking at, what are you looking, so we can all be on the same page. And this kind of question would never happen. I myself don't know the exact questioning that goes along with it, how the evaluation process is, who's doing the evaluation, and how do you come to this realization that this company would probably be the best one. At the end of the day, I know you people are doing your best. I'm not questioning that. I think the processes that we do have a communications gap in there of how we're doing them. And I think we've been saying this already for a while, and we're not going to get to know everything that goes on out there, but we can at least know the processes, and how this particular project comes from start, from it being a small seed in the minds of everybody of how this project's going to start to the end result. And like I said, I've taken some of my time to go and see some of those, some of these processes, but I'm still not very clear on them either. So, I think if we can find out as a board how the evaluation process goes, then 95% of these questions wouldn't be asked.
Yeah, just real quick. What Dr. Nelson, what he said had made a lot of sense. If it would have been brought up in a different format, saying, that we're giving $700,000 to this company because they qualify themselves to be able to do that kind of work, and the other ones do not, or didn't even apply to do that, but it applied to what's out there, then it makes a lot more sense. But the way it's presented to us is, these are the ones that bid on it, this is what we're giving you, and this is what you're giving you. It might have been that they didn't even submit for the bigger project because, like you said, they don't have the capability, they don't have this and that. If that would have been said, it would have made a lot more sense, that we wouldn't have been discussing it for 30 minutes.
Yes, sir.
Next item.
Next item.
Thank you. 4H.
The Cooperative Purchasing Network, R-5191, This is for the integrated system software upgrade for cooling system. The Evaluation Committee recommends awarding the contract to Schneider Electric for an estimated amount of $44,635. Item 4I, U.S. Communities Government Purchasing Alliance, number 4400001195. This is for software licenses. The Evaluation Committee recommends awarding a contract to Inside Public Sector for an estimated amount of $156,114.
What funding source is that, ma'am? Sorry. That number 4I?
This is General Operating Fund, and I'm thinking this is E-rate. Mike? Yes? Fund 181.
None of these public, or none of these licensings go under federal funds?
No. There are E-rates.
Okay.
And the funding is incorrect. We'll correct that. Item 4J, Department of Information Resources, co-op vendor number DIR-SDD-1876, security camera maintenance, support and installation. The Evaluation Committee recommends awarding a contract to Kalen's Physical Security Solutions and Inside Public Sector for an estimated amount of $640,000. Item 4K, Texas Association of School Board by Board Co-op vendor number 413-12. This is for athletic equipment and supplies. The Evaluation Committee recommends awarding a contract to Cardinal Sports Center for an estimated amount of $120,000.
Are they local? No. No one does that locally? Not that that matters. Okay. Not that that matters. Never mind.
Okay, can you just give me, on the previous one, on the security camera update, when's the last time we did that?
We do this yearly. We've
For
been installing.
$644,000? $640,000?
We've actually done more. This is for the, right now we're
The cameras.
replacing the camera system.
Right, I know we did it last year also through. when
This
we-
is, I believe we gave them additional funds this year out of the excess because some
We were short.
areas were, right.
To finish. This finishes it.
All right.
Okay, for L, TASB by Board Co-op vendor number 416-12. This is for band uniforms. The Evaluation Committee recommends awarding a contract to Demolin Brothers and Company for an estimated amount of $180,000. Item 4N, Region 1 Purchasing Co-op vendor number 14-02-12. This is for staff development and instructional materials. The Evaluation Committee recommends awarding a contract to S3 Strategies LLC for an estimated amount of $50,000. Item 4N, RFP number 15-038. This is for security gates. The Evaluation Committee recommends awarding a contract to Rizuma Construction LLC for an estimated amount of $36,900.
Where do we have security gates?
Division of
This will be,
Operations,
right, and
McDonald.
CMP.
Yes, that will be for those two locations.
CMP.
Okay.
I think that was to replace some stuff that was broke, right? Accident or whatever? Yeah.
It's a remote.
It's a remote, open and close. All right,
May I
for,
proceed? For
Yes.
O?
Yes.
For O, RFP number 15-043, Property and Casualty Insurance. The Evaluation Committee recommends awarding a contract to IBC Insurance for an estimated amount of $643,000 with $64.
and for the record, Dr. Moreno, that agenda, that budget amendment 4.0 matches item number 21, which is the interlocal agreement that is required for this board to approve between LISD and the Texas Political Subdivisions Property Casualty Joint Self-Insurance Fund. And the vendors that we're talking about for property casualty have to go through the Texas Political Subdivisions Property Casualty Joint Self-Insurance. So that's why we're asking for the interlocal agreement.
So they didn't respond to us as an RFP?
They responded.
They did, but we were just not members. We need to join in order to access that pricing.
And then on the tax refunds, if we may, Dr. Moreno, items 5A through 5H will be recommending approval.
Yes, sir.
And if we can have permission to proceed? Item number 13 is discussion and presentation on the adoption of an early notification incentive program for all full-time employees for the 2016-2017 school year. Dr. Moreno, members of the board, what we're proposing, this is a follow-up to Mr. Pettis' comments earlier. We're trying to get our Human Resources Department to be able to plan accordingly and balance our staffing in a way that balances our budget. And so we would like to propose an early notification incentive program that would ask all of our full-time employees to make us aware of their intent to exit from the school district. And we have very specific structure and criteria that we'd like to identify, but we'd like to set a date, I believe I think we said the end of March, like March 31st, April 1st, some of those, that window. And we would like to offer all professional employees who make us aware of their intent to resign or however they choose to exit the district, we would like to pay them $1,000. And for each paraprofessional that chooses to participate in our early notification incentive and make us aware by April 1st that they're leaving the district, we would like to pay them $500. That matches the early notification incentive program funding that our neighboring district is doing. We can't even begin to anticipate how many employees will want to participate, but we just thought it was an idea. Mr. Pettis can speak to it as well because he mentioned the idea, but we just thought it was a good idea to put out there and try to help us plan our for next year a little earlier. Any comments or questions? We'll be asking for approval on the consent agenda.
What was our first incentive when we did this?
Way more.
Oh, I understand that. That's my question.
I can't remember.
Yeah,
like
because $1,000,
$2,500 or
that's
something.
an insult to the teachers that have been working with us for a long time.
But
It was five.
But this is not only for those that are retiring, this is for anybody who's planning to leave.
Transferring.
Yeah, it's not just
That was only
retirement.
for everybody that was retiring.
Oh, okay.
So
Good
it is
point.
a
So
little
can we have
different.
something to leave? And
Yeah, maybe we can look at something a little bigger if they're gonna retire, and then something to
I
leave.
think our teachers are worth more than $1,000 in retirement. If they're gonna leave, that's fine, $1,000 buy. But if they're gonna retire and they've been with us for a while, I think it'd be just appropriate to do that. For
Has
their
it-
dedication to our district.
Has it worked in the past, Dr. Nelson?
Yep.
I'm sorry, Mr. Noyola?
Has it worked in the past?
You know, when we did it the last time, it was several years ago, and as Mr. Garcia said, the numbers were different. So people, I think, were a little bit more motivated. And actually, the year after we did it, you know, people were coming the next year like, are we doing that again? And when we didn't do it, I sense people were disappointed. So to answer your question directly, I think people appreciate it, whether it's 1,000 or 500. It's more than what they were going to get if they're leaving the district, and so...
I don't think our plan is to encourage anybody to leave.
Exactly.
It's to encourage them to tell us. if-
Early. The earlier we know, the more we can plan.
After a while, you also don't want to just continue to lose your teachers that
That's
have
true.
experience.
Well, and see, what happens is we have a lot of people who they wait till the last day they can get out of their contract to come and try and get out of their contract, and I want to be clear, that's when we start denying people leaving their contract. So they get a second grade teaching job in another district, a neighboring district. Well, if you wait till the last day, we might not let you go. And the neighboring district is the same way, for the record.
I hate to be just negative, but sometimes we procrastinate and we don't make decisions when we should be making them.
That make
and-
people
and-
leave.
And they make people, I mean, you know what I'm talking about. The
Yes, sir.
decision's gotta be made. If we're going to make changes, or we're gonna do that, they gotta be done in a timely manner, and that sometimes doesn't happen.
Yes, sir.
Next item.
Excuse me, not with you.
Let me just say that this is not a reward
Oh.
for their quality of teaching or administrations. Okay, I know we have excellent teachers, but we're not rewarding them for being excellent. We're just rewarding them to letting us know that they're going to leave early so we can plan, for next year.
Okay.
Next
All right.
item.
Thank you, Dr. Moreno. Item number 14 is update and presentation on attendance. Dr. Moreno, members of the board, in the background information, you received a PowerPoint like this. And basically, this is a follow-up to a recent audit conducted by our internal audit department. And we just wanted to allow the board an opportunity to discuss it and the ramifications of the findings. The internal audit department completed a study in the fall, and in the audit, it was basically examining our attendance procedures, and specifically, were they being implemented at the level, district level staff was claiming that they were being implemented. It was asked to be investigated by Trustee Garcia. I believe Ms. Henry did an excellent job in really preparing a report, working with student services, and identifying aspects of our attendance procedures that can be improved. For the record, the first thing that the audit found was that it is true, as Mr. Garcia speculated, that not all campuses are following the attendance guidelines that were clearly delineated by our Office of Student Services. There also was a finding that there is a urgent and critical need for more specific training on how to complete our attendance procedures in a way that's honest and ethical and really allows us to present an accurate percentage to the board and to the public. And then one of the third major findings was that one of our newest programs, Skyward, really lacks the program support in terms of the people who are trained and how they transfer that usage of Skyward down to the end user, which is in many cases our campus staff. So those findings are well taken, and they do affirm the I want to say allegation that resulted in this inquiry. And the action plan that Student Services has put in place is that principals are expected to do a turnaround training with their faculty and attendance clerks and attendance officers. Documentation on those trainings is being collected. In case that expectations are not met by the campus, which is what we're finding, then administration on the campuses will need to be documented as we complete our random daily visits on attendance and that aspect of student services. We had a training on January 18th, 2016 to ensure the accuracy on the policies and procedures. A student attendance procedures manual is being completed and will be provided to the campuses basically so that we can start our attendance planning for the first days of school in 2016. And closer monitoring of attendance submissions really needs to happen in our attendance department under the direction of Mrs. Cindy Mendiola. We'll work with our principals. I won't go over our daily attendance numbers. We really did some of this at our recent budget workshop, but the last few slides just basically shows where we're at with our attendance, and you see, I mean, we've been doing this a while now, but attendance starts high and slowly it becomes a bigger and bigger challenge as we go through the year. Dr. Moreno has made an excellent point that we need to do more to encourage perfect attendance and acknowledge the kids that work hard to be at school every day. And our Chief Financial Officer has made it real clear that $22,400 is not the ADA that we should be seeking because our enrollment has declined. So with that, I don't know if the board wants to ask some questions or
I have some comments, but I'm going to leave those comments with Maggie, with Ms. Martinez, and you in private, because
Yes, sir.
they're confidential, and I don't want to, but I would reach that, and that the reports that are brought in attendance on a percentage is based on second period. Yes or no?
Yes, sir.
So none of this board ever sees first, third, fourth, the other classes, which, if you actually look into it,
That's where
are,
they're skipping.
if you think we're bad at second period, which is okay, you need to see the rest of the scope of the classes. Because they make it, and correct me if I'm wrong, make it a deal to get second period, but third and fourth, it's just.
So we go through
And we're
today.
not seeing that, the board is not seeing that. I've asked for those numbers, I'm trying to
Yeah, we'll
to
get them.
just to look at them, but that's something that we really got to concentrate, because remember, they got to be in school, now it's by hours or by minutes or whatever, but by law of the 90% that they're not in the other classes, what are we doing to prevent that? Because if you look at it, I can tell you a good amount of kids lost credit because of attendance, and what paperwork have we done? Because I know that, well, I don't want to get into that other box.
No, that's a good point. That's a
Talk
good
to you later
point.
about that.
Any other comments or questions regarding attendance?
Next.
Item number, we'd like to table item number 15. Our Chief Technology Officer had a conflict. So can we move to item number 16?
16.
Item number 16 is discussion and presentation on the memorandum of understanding between the Laredo Independent School District and the 406th Judicial District Court, Judge Oscar Hale, and Serving Children and Adults in Need Incorporated, SCAN, at an estimated cost of $5,000. Dr. Moreno, members of the board, as most of you know, we recently hired a substance abuse coordinator, Mr. Victor Oliveros, and he has been doing a fantastic job at Jose Valdez Non-Traditional High School. An innovative program that he is proposing that we bring is a partnership with Judge Hale's court that basically pilots a drug court program for the adult students that are at Jose Valdez High School. And so the $5,000 that would be requested for this program would be so that the drug assessments can be done weekly or daily or however often they do them. And we're very excited to bring this program as something to address our substance abuse concerns that we know have been a priority. Any comments or questions? We recommend approval. May I proceed?
Yes.
Item number 17 is discussion and presentation on Scholastic Year Calendar 2016-2017. Our Chief Communications Officer has worked with the rest of our cabinet, and we now have a recommendation for a calendar that is basically identical to the United Independent School District calendar. And we were going to bring it in January, but there were actually 2 small days that didn't match in January. And we've adjusted our calendar so that those now, if you're a parent in either district, you have same calendars working. If you remember this January, we actually started school a day before United, and the feedback we got from DEIC was that created some challenges for some of our families. So in the interest of time, we'll be recommending approval on the option that is presented in the background information, which I believe is option A. C. And DEIC has been made aware of the updated changes that we're presenting to the board. And are there any other comments or questions regarding our calendar? If not, may we have permission to proceed?
Yes.
Just a small, very quick. Have we taken into consideration some of these calendars? As you know, I've texted
I'm
you on some of
listening.
these issues, whether or not some of these teachers that are going to have parent-teacher night that night, and then they have other items to go through during the day. I think it's a reoccurring theme that a lot of them complain about.
Mr. Garza, if I may respond to that, Mr. Garza has made me aware of that along with other trustees, and we will take account of that. We're asking our Chief Academic Officer and our Chief of Staff to really organize what we call a teaching schedule. So what that is, just for Dr. Rios' understanding, is when we have, in August, we'll have professional development that your office is coordinating from 8 o'clock in the morning to 5 o'clock sometimes, maybe 4:30. and then we'll have a Meet the Teacher night that starts at 4:30 and goes to 8 o'clock at night. And it just puts our teachers in a position where they can't really concentrate on the professional development, they can't concentrate on the Meet the Teacher tonight, and so it's a calendar. It's not the calendar that we're being approved, it's the schedule that teachers are on, and absolutely, we will address that.
The overlapping of certain items that.
Responsibilities.
that I was talking about earlier, yeah.
It's just a few times each year. But yes, we will address that, and you can
That is
document
good.
that.
Next item?
Item number 18 is discussion and presentation of the current year's capital improvement plan status, potential repurposing of funding, and 5-year planning for other upcoming projects. So Dr. Moreno, members of the board, we have our Executive Director of Plant Facilities and Support Services. He's given you a host of versions of the capital improvement plan, including one that is light blue, one that is legal sized, and one that is 8.5 by 12 landscape, and then a summary of what he's speaking to. And really, if you remember earlier, we had a budget amendment that was connected to this. So I'd ask that you just start with the things that you want to move up that require the budget amendment, and then we'll go from there. Mr. Velasquez?
Thank you. As Dr. Nelson just mentioned, you're going to see a summary of the amounts that we have available on the current capital improvement plan. You're going to see that we have this one in red, and we have some remaining balances on those particular items. So that doesn't mean that we're not taking care of that, but that we found another way of funding those particular projects. So the total amount at the bottom is $139,000. On the second page, you're going to see that we're planning to repurpose that amount into 7 projects. We have 2 marquees, one for Alma Pierce, another for Kate Tarver. Those are probably, 2 of the last ones that we haven't replaced, recently. We are also asking for, approval on the purchase of 1 additional maintenance vehicle. So we got a total amount of $70,000, but, we work with the vendors, and instead of buying 2, we could afford 3 with the same amount. So that's basically what it is. Cigarroa High School, currently we have lack of lighting, sufficient lighting at the gym. So we are adding metal halide light fixtures at the gym for $16,500. As you know, we just moved our students to Valdez High School. We have problems with leaks. We haven't touched that roof in a long time. So the estimate for that particular project would be $53,000. Ryan Elementary, trying to be consistent with, all the areas that we have in the district. We're trying now to have the same features that we have currently at Santo Niño. So we have an estimated amount of $14,000 in case, the board wants to approve it. In Cigarroa High School, they are requesting the purchasing of an ice machine for the gym area. So pretty much those would be the projects that we're trying to repurpose. Is within the same $1.5 million. We're not adding, anything to the overall amount. And we're going to be, that's our recommendation when it comes to repurposing.
Ms. Moreno. Ms. Moreno.
Yes, Mr. Perez.
This is another thing. On the buying of vehicles, last year I mentioned it to Dr. Nelson about the ones the band has. There are 3 trucks, one at Martin, one at Nixon, and one at Cigarroa, that haven't been replaced for the longest time. So we need to focus on that, Doctor.
Yes, sir.
I don't know from where we can fund those. Thank you.
We'll look at adding it to our capital improvement plan.
Okay, the next document that you're going to see is basically the same information that I just discussed, but this is like the formal CIP format. You're going to see that in yellow, we have the items that we're getting the monies from. And at the second page, you're going to see a peach color that is depicting the project that we're recommending for repurposing.
Any comments or questions?
Taking money away on the one in yellow.
We are taking monies away from the yellow ones, and we are funding the ones in the peach area on the second page.
So then the final, go ahead, Mr. Velazquez, I apologize.
No, don't worry. The blue copy is basically a copy of the current capital improvement plan with no amendments, no changes. You're going to see that we have some items in red, and all those items have been encumbered as of right now. So based on the amounts and the different items that we have in here, we estimate close to 82%, of progress on the capital improvement plan. And you're going to see some little notes on the second page as well. We added, originally it's 1.5, but for one reason or another, because we are able to do that, we've been adding either surplus or local funding to fund other projects. So all those projects are, immediately dumped into also the capital improvement plan as we go. And the last document that I have tonight.
Real quick, what are the dark green ones for?
I'm sorry?
The dark green on the second
The dark
page?
green, it was like the amendment that was approved back in October. There was some, additional funds that we repurposed for vehicles and buses. And those were already, updated into the capital improvement plan because we approved them last year.
So we already bought all that?
Yes.
Okay.
True, yeah.
I want to see it. Okay, thank you.
So the last document is the ledger size. And you're going to see that we have 5 years showing in there. There's one column that currently you cannot see, that is 2012, 2013. So we are basically showing like the year in the middle, that it is 15, 16. We're showing 2 previous years and 2 future years. So that's basically what it is. If you go to the last page on this document, you're going to see that for this current year, a total estimated amount of 8.5 million have been allocated to the capital improvement plan. The subsequent years, you're going to see that we don't really have the 1.5 identified at this time. You're going to see the 2 main colors, that is local E and local F. And eventually, what we've been doing is, as we go through the budget process, we prioritize the projects and we make sure that we present to the board what we believe, as a district is a good compilation for the 1.5 million. But as of right now, it hasn't been screened. So it's basically what we have.
Very good.
Angel, one question.
Yes,
I don't have my glasses. Do you have any plans for wrought iron fence around Martin High School and the Four Corners and Cigarroa High School?
We brought that to the board.
Yes, we presented some estimates, and every time that we discuss something like that, we put it on the capital improvement plan. So I want to say that that will be part of this coming budget process, and it will be there reflected. And if there's like additional monies in between the year, we can always discuss it for approval. If not, eventually we're gonna tackle that project as funding becomes available.
Can you try to get sponsors for the scoreboard at Cigarroa High School? Everywhere you go out of town, you see banks, anybody sponsoring scoreboards, and I think we have a good relation with a lot of people here in town that will be more than willing to sponsor the scoreboards.
We can definitely look into that.
Maybe the Boys and Girls Club.
I can get you some names.
Yeah. Okay.
Mr. Velasquez, real quick.
Yes, sir.
You have $1 million for the Martin High School tennis courts on this page.
Yeah, but I don't think it's
right.
I don't think it has any color, right? I mean,
Right.
I think it's that was the original old amount that we had.
But that's not even there. That was estimated within the bond.
Yeah, that's part of the bond. So that's why originally it was a request on the CIP, but we ended up funding it through a different avenue.
That doesn't
It's a good thing that you have those in there in case we forget them to put them anywhere else, that we find the funding.
And the
source
projects
for
that we're trying to repurpose were in the 2 subsequent years, so we're trying to move them for this year. And the way we do that is that we try to select projects that we know that we are capable to finish before August 31st.
Absolutely.
But like the rebate to Dikes either, you haven't allocated $40,000 that was allocated several years ago for that particular school. It's not colored in either.
Dikes?
Uh-huh. Right?
Next item?
I'll go back and look at it later.
Okay.
Okay. Item number 19 is discussion and update on potential upgrades for sports facilities proposed for the LISD Performing Arts Center site. In the interest of time, this is what I would simply say. This board has already received a sports package presentation. It involved approximately $2.4 million in an upgrade to Veterans Baseball Field, which we would ask respectfully if we could use the mid-year review as the funding source, if that's the appropriate, and a $275,000 shade structure over the pool. You know, this board made a commitment to shade structures because of the unusual heat in the summer. So if we're going to do that for all of our playgrounds, it just makes sense. We have hundreds of kids a day at our pool, so we would want to cover that as well. And so we recommend the mid-year review to fund both items on the sports package if it's the will of the board.
Next item?
Item number 20 for the record is discussion and presentation on an interlocal agreement between the Region 2 Co-op and LISD for instructional materials and services at no cost to the district. This is for textbooks and instructional materials, and it's with the Region 2 Co-op. We recommend approval. Item number 21 is discussion and presentation on an interlocal agreement between the Texas Political Subdivisions Property Casualty Joint Self-Insurance Fund and LISD for property and casualty insurance at no cost to the district. This is the insurance vendors go through this fund and work through that fund for us. And that brings us to communications and updates. If I may quickly, we will have our regularly scheduled board meeting this Thursday at 5:30. And I have a couple special birthdays. I don't see Mr. Oscar Pettis here. Is he here? Well, he's not here, but we want to wish him a very happy birthday on this last Sunday. And I believe this last Friday, our outstanding local reporter, Miss Judith Ryle, had a birthday, so we want to wish her a happy birthday as well. That concludes our updates and communications, Dr. Moreno.
So unless we have anything else, our meeting is adjourned.
Thank you.
Meeting adjourned.
They all said.